Today is the launch of a white paper which sets out how we might galvanize cross-sector action towards heat resilience in the US. And I will just introduce the paper, give you some of the highlights, and then we have 7 amazing panelists who are all going to bring in their own way the report to life from different parts of the system. So if we move to the next slide, please, Clara. So just for those of you that aren't familiar with the Climate and Health Coalition, that is, we're the hosts of the call today. It's a coalition convened by Forum for the Future, supported by several of the corporates on the call today, notably Train Technologies, who have supported the heat work all the way through. Thank you, Scott. You'll hear from Scott in a moment. And the purpose of the coalition, which is also supported by a number of non-market actors, including the Clinton Global Initiative, I think are also on the call today. The overall objective is to mobilise private sector action at the intersection of climate and health. We really understand the potential of the private sector across all different parts of business to really begin to treat climate and health as the flip side of the same coin, and therefore design strategies, products, services that really drive co-benefits for climate and for health. So that is the organisation and the collaboration behind this white paper. I think the next slide moves into the challenge that this white paper addresses. And that is the challenge of extreme heat. The focus of the white paper is the US, but we're hoping that the format in terms of setting out what we can see from different parts of the private sector, what we can see from policymakers is applicable to any geography, because effectively it is a roadmap for collective action. And in front of you now are just some really significant statistic that speaks to the fact that heat is really now a serious hazard in the US. The economic impacts are significant, and we see data like this from other geographies in the world. And we just know that as we go through a summer in the Northern Hemisphere, we're experiencing more communities under strain. And we also know that at elevated temperatures, basic medicines perhaps work less effectively. So heat really matters. It's a problem that we're just really not prepared for as an economy, as a society, and it's a challenge that is intensifying literally on an annual basis. If we move to the next slide, which really speaks to why the fact that heat is this essentially a systemic challenge. In terms of building a response to heat, we need the system to come together. No single sector, as it says here, can address the heat risk alone. And the heat touches everybody. It touches us as individuals, communities, our families. It obviously is specific to context. And so in order to build heat resilience, we need to activate the full spectrum of our economy, but also our society. And I think the next slide just is a bit of an overview of how we built the white paper that we're publishing today. It is already on our website. We'll share a link in the chat as well. But the genesis for this work actually began in New York Climate Week a year ago. We hosted a lunch, the we being the Climate and Health Coalition, and we invited our partners to come along to the lunch. Those were different private sector actors from different parts of the private sector, from the built environment, from insurance and so on, health. And we also brought together policymakers and non-profits. And we asked the question, if we really, all of us, brought our distinctive assets to solve a particular issue, what is an issue that will really benefit from collective action? And the resounding answer was heat, in that we could really envisage a collective response to heat from different parts of the private sector, plus policy, plus non-profits and community voices. And fast forward to June in Manhattan, we convened, again supported by Train Technologies, a really wonderful convening. And I think some of you on the call today were present in June. So again, thank you for that. A lot of your insights and recommendations have made their way into the report. But we brought together a really diverse group of individuals from across different parts of the economic system, and really started to understand, well, what might collective action in terms of heat readiness look like? And what we discovered, there was lots of individual strands of activity: workforce health, place-based health, heat resilience. But actually what we started to do in June was start to build a thread between those different sets of activities. And it was the convening in June that has really laid the foundations of the report that we're talking about today. So if you can move to the next slide, please. At the convening in June, we came up with this vision, which is really articulating an ambition that through collective action, strategies for heat resilience, heatwave preparedness could be incorporated across the economy. And actually, we could create the conditions in which communities and workforces experience better health outcomes, and we build greater resilience to extreme heat. And we really built out that vision in the white paper around certain outcomes, so reduced emergency visits, community-wide resilience, and critically also reduce work disruptions. As I mentioned a moment ago, we're seeing severe economic impacts of lost productivity due to heat. So that is the overall vision that the report is really setting out a roadmap to deliver. The next slide talks to the specific levers for change that we focused on in the report. Heat, as is the case for climate change, as is the case for health, these are all systemic challenges requiring system shift. And what we've used in the report is what we understand through lots of collaborative work at Forum for the Future, different levers that we can pull to start to create a different way of operating for the system. And in the report, we talk about how we can use information to be shared in different ways as a way of building awareness around an issue, which helps create a robust case for change. These are all the levers that we need to pull to move a system through a transition from creating the robust case for change, creating collaborations, through to accessing the right incentives, business models and financing. And we also need to shift cultures, behavior and mindsets. And then finally, when we get to a system beginning to settle down to a new way of operating, and in this case, it would be an economic system that has got heat resilience built into it, we need the right policies, we need the right rules, measures and standards. And the panel discussion today will bring different aspects of these levers to life. I'm just going to hand to Cassina now, who's going to say a little bit more about the report before we ask our amazing panelists to share how they view the report and how they're bringing together the recommendations in the report to life. Cassina.
Thank you. And next slide, Clara, please. Yeah, so I wanted to quickly share about navigating the recommended action section. And this is if you are ready to jump into action, you're thinking, what can I do? What can my company, how might we start taking action? This is the place to go to. It's section 4 in the report. And we really lay out practical actions using our business spheres of influence framework. So this approach helps companies see where they can act from their own operations and workforce policies, products and services, supply chains, communities, and the wider enabling environment that they shape through partnerships and advocacy. And you'll see that each recommendation has been identified either as foundational and advanced. So if you go through the report itself, you'll see the recommendations. And that's recognizing that not every organization is starting from the same place. And as you're thinking through where can I start, looking through the foundational actions are those that we believe that every company would take as basic duty of care, while the advanced ones require deeper investment and innovation. And then the section of the report also offers sector-specific guidance. So really looking at specifically at the healthcare industry or insurance, technology, and built environment. And then we also provide a multitude of case studies to really illuminate and showcase this is how others have taken action in this space. And I'll pass it back to Sally to introduce our panel to really bring it all to life.
Thank you very much, Cassina, and welcome to those of you who have just joined. We're really sorry that there was a problem with the link in the Eventbrite. We are hugely grateful that you battled through the technology and you've joined us. So thank you so much for coming here today. But this is the best bit. This is where we ask 7 brilliant leaders from across the ecosystem to bring different aspects of the report to life. This report, I think, is the first time we've set out what a collective action roadmap could look like for heat, focusing on different parts of the private sector, policymakers, and so forth. And as I said at the beginning, even though the context in the case of this report is the US, we think the approach, which is really spelling out what we can expect to see from different parts of the private sector, is very replicable to other geographies, particularly multinationals. So here are your amazing panelists. They've all contributed to the report in different ways. Their organizations have participated in at least one of the two convenings that led to the report. And I'm going to kick off the panel by asking Scott to say a few words. And Scott is the person that's really supported this work from the very beginning and has enabled us to run the convenings in June and then the event that we ran as part of Climate Week in New York, and is one of the main reasons why we're here today and able to share this report. So Scott, would just love to hear a few words from you as to why you think this report is so important.
Yeah, thanks, Sally. Thanks everyone for joining too. It's an exciting day just because we're finally launching something that we've been working on now for quite some time. And I think it is the first step in maybe identifying the best solutions going forward. This is not something that we're going to solve quickly. And I really appreciate how this has been a collaborative effort, how it's also been one that has had a diversity of opinions and voices in it, which is really important. I think we're at a point now in how we solve things to know that we can't really solve them in a vacuum. So my appreciation goes out to Sally and the team at Forum for the Future and helping get us all in a room and several times to hear the opinions and views of a variety of really smart people on how we go forward. And my view from a trained technology standpoint, where we spend a lot of our time trying to improve the built environment, I actually dialing in today from Berlin, from COP30. It's 33 degrees C already, 92 or so degrees with a high humidity, on the way to 37 degrees C or 96 degrees today. It's a hot, humid day. So I'm probably in the best positioned person to talk about what's really going on in the world. We've all experienced it, but my view and the company's view is that extreme heat's becoming sort of a defining moment for the built environment. I mean, even though this was US focused, the facts are that last year alone, half of the world's population experienced at least 30 days of extreme heat. And unfortunately, urban areas where most of the large buildings are, that's even exacerbated up to 7 degrees F, hotter than the surroundings due to the urban heat island effect. And look, I think buildings are now a contributor to this issue. It's also part of the victimization of what's happening with the extreme heat that we're all experiencing. I mean, this extreme heat is straining our energy systems. It's raising cooling demand, which also creates some really unsafe situations for the world in terms of the energy required, refrigerants to cool everyone. It's also some unsafe indoor conditions where the cooling doesn't exist. I mean, I received an alert on my phone myself earlier today in Berlin saying that it was a high rating of extreme health for being outdoors today in the afternoon. So this sort of proof right here on the day that I'm living in that there's a big issue because the cooling doesn't exist to keep us all healthy. And so there's a big barriers to that. I mean, our existing buildings were designed for cooler climates, and we have not designed in the buildings the things that are needed to handle today's extremes. And there are some solutions though, and I'm hoping that this paper is the beginning of a discussion around how we solve some of this. And I really appreciate this diverse panel that you've collected to get together as well, Sally, today. I think it's an important conversation that's just beginning. So thank you.
Great, and thank you, Scott, and thank you for joining us from Belém. We appreciate that you were able to find access to Wi-Fi and all sorts of other ingredients that enabled you to participate. And thank you for that, salient reminder. Heat is a very, very real challenge.
Yes.
And yes, indeed, in the white paper, we go really granular in terms of what built environment actors can do, what insurance can do, and so forth. And we also talk about healthcare workers, a really critical part of the system in terms of building that heat resilience. And that leads me nicely to Phil, who is our next contributor. Phil Darling from J&J. Welcome. Thank you for joining us. Phil, tell us a bit more about the perspective from your organisation and the work that you've been doing in terms of community healthcare workers in particular.
Sure. Thank you, Sally. Well, as Scott mentioned, he brought up the topic of health, and one of the first places we see the impacts of extreme heat is in health outcomes in patients. And so, our journey started back in 2021. We're during the COVID pandemic, but we were having conversations with one of our partners that does aid work, and they were working with community health centers, and the community health centers were starting to express concerns about how climate change is impacting them and their patients. And when we did basically a listening tour with a bunch of community health centers, the number one topic that came up that they felt they were unprepared to handle was extreme heat events. So we pulled together basically a network of partners to tackle this problem, to see, what is it that we can do for these community health centers to help them prepare for what we call the heat season, and then and to be able to better, respond during heat season. So, it took a number of partners, academic partners, NGO partners, private sector partners, to come together and figure this out. We started with what's the evidence base? What are the actions that can be taken that have been shown to be effective for community health centers? And then put that into actionable plans for them. And that was really the biggest challenge here, was making things actionable and making it easy for them. So one of the big things we heard was, hey, we're just actually, at the time, we weren't even coming out of COVID. We were still in COVID. They're like, we have limited resources, so make this easy for us, make it actionable. And so, we developed a method to lay out basically top 5 actions for each community health center that we were working with, based on, their patient populations, geography, things like that, to give them a bespoke plan, but also make it very kind of resource light, so that it wasn't a big lift for them, that they would shy away from actually taking action on the plans that were laid out for them. So this has been very popular. We've directly assisted over about 175 clinics over the past couple of years in developing those plans for them. And now we're basically moved into measurement and effectiveness phase of this project. But it's been really, really appreciated by them, because these community health centers are where, they're serving some of the most vulnerable patients, and that's where heat's hitting first. So.
Great, thank you. And I should say that the work you've just described is one of the case studies in the report. So alongside very specific recommendations for different parts of the private sector, for policymakers, and so on, we've also included a number of case studies. We will have one from Train, you've just heard from Scott, but we also shine a light on the work that J&J have been supporting community health workers too. So those case studies are there also for inspiration, and hoping that they'll inspire replication across different parts of the US, but also wider. So thank you very much, Phil. Another key contributor to the report has been LAILA Network, who have been focused on workforce health and safety, and particularly exposure to extreme heat. And it's my pleasure to ask Barrett now, if you wouldn't mind, just to share a bit of the work that you've been doing and give that perspective from the worker point of view.
Yeah, thank you so much. And I want to continue on the same platform of thinking about solutions. We know a lot about the problems of extreme heat, but there is more research to be done when we talk about solutions. So I prepared one slide that I can squeeze in this 3-4 minutes that I have. So this is an example from the work that LAISA Network is doing. So these sugar farms in Nicaragua, and you will find the entire case study in the report that Sally mentioned, and you can read it there. But basically, the workers there are working extremely hard. It is very strenuous labor. It also is very hot, and many countries in Central America are becoming hotbeds of chronic kidney disease because of this. So the work that La Isla Network did is not rocket science. It's simple interventions. There are rest, shade, water, and sanitation. But the question that has always been a problem is the rest part. When do we introduce or prescribe rest? For how long is it that we need? And what the employers think about this. And one of the main questions and one of the main problems is that the industry and farms have always been worried about introducing rest. But if I can show you this graph, and if you start looking at the worked hours, so this is the same sugar farm we've been following for more than 10 years. So, and then we introduced these interventions over the year. So these interventions started to begin in 2015-16, and then all the way in 2018-19 that we scaled this up. But you see that the work hours started at 8 hours in 2012. So this is when the workers used to just continuously work all the time. And what you start seeing is that when we introduced these rest breaks, the workers started to work less. So it dropped from 8 to 6 hours to 5. And then when we scaled all these rest breaks that were prescribed, we got down to only 4.8 hours. But look at the productivity of the workers. And I'll tell you one thing about this, that we use the most objective way of measuring productivity, because guess how these workers are paid? They're paid by the piece. So come the end of the day, how many crops that you collected, put them on a scale, and you get paid on the number that I see on the scale. So we looked at exactly how much tons they produce, because that's their living. And you see that the tons per hour almost doubled from 0.78 to almost 1.6 tons per hour. And the overall production for the farm also remained the same. So that's a win-win situation. We reduce the hours that the workers are working, we introduce these rest breaks, and guess what? The productivity actually doubled. So this is the kind of solutions that can be scaled that actually shows that the industry can also benefit from this. The workers will also benefit from this. And if you can read, if you want to read about this entire intervention and the details of it, you'll find it at La Isla Network and also in the report here. And I'll stop.
Thank you, Barak. I think this is a brilliantly easy chart to understand, and thank you for focusing on the solutions. And that's what we found through the work over the last year, is there are lots of solutions out there, but they're in pockets. And what we're trying to do with this report is to really elevate the understanding of those solutions and encourage replication across different settings. What we've also discovered is that one of the challenges when it comes, and therefore the solutions to building heat resilience, is actually communication. Particularly when we hosted the session in June, it became clear that the impacts of heat on personal health weren't necessarily as well understood as they could be. And also the solutions were out there in pockets, but the awareness of those solutions wasn't as high as it could be. And so I'm really happy to invite Natasha now from Burson, who is a communication and marketing specialist, corporate affairs director, SVP. But Natasha brings that perspective of communication into this whole suite of solutions. And it's so important. Going back to that chart of the levers that we can pull in any systems transition, culture, behaviors, stories, narratives are so important. So Natasha, over to you.
Thank you, Sally, and thank you so much for having me here and Burson's perspective represented. It's wonderful to hear about all the real life actionable work that's happening on the ground through the other speakers today. If you would take us to the next slide, please. Thank you. So I won't do a full lecture on the state of the U.S. news media, but I think a little bit of education can be helpful when we think about how we would want to leverage media and communication to move some of these actions forward, both for the industry itself, which if you look at current estimates are maybe about a $570 billion industry. That's just newspaper and TV news. That doesn't count kind of the larger ecosystem of what media we could potentially use. You think of social media platforms, content, movies, television, it's much, much larger, but we're talking about kind of news and maybe the way that we see it now. And then the shifting consumption. So like many of the industries represented on this call, things are consistently changing, but as someone who lived through the advent of the internet's impact on newspapers as a journalist, that type of shift has continued to impact how the media both tells stories, where it tells stories, and how it is able to take in new information and take in new issues like, say, heat preparedness. It also impacts where the people we're trying to reach, whether that be the average consumer in a local community or perhaps business stakeholders, how they consume their news, who they trust as well. With the decrease in news at the local level, there's increased fragmentation. Like who you and I trust now on this call to give us news could be a whole kaleidoscope of people that we're getting information from. It's no longer a monolith, say, ABC News or New York Times. So it's something that just to consider as we think about how we move action within the industry. So some of those tactical points that we want to address with them as, operators in the world and how we would like to work with them to help spread and drive action within the issue. So it's still a very powerful tool for issue influence. The next slide, please. Thank you. And I think it's helpful when trying to move forward an issue like heat resilience to look to past issues and how that trajectory has brought us to the current state. So mental health is one of those topics that I feel is not apples to apples, but we could learn from the trajectory of this issue. Mental health not that long ago kind of lived in the shadows. It was maybe not, stigmatized, and it was a combination, decades really of advocacy and nonprofits and data-based storytelling to bring, the issue to light to help remove some of the stigma. There's three kind of areas that I've identified that I think help to have moved that issue forward that I think we could learn from and take forward specifically in some of the actions that we're looking to take within the white paper. Public awareness campaigns are obviously an extremely powerful tool. Typically, it's nonprofit led, but often corporate foundation funded, driving those issues forward. When it came to mental health, there were a few that particularly stood out and helped elevate the issue more within the public sphere. Which is a tactic that, from my perspective, I think could be quite helpful in the right coalition format to drive relevance on this issue at the local and even the national level. And that often, in some ways, dovetails with the appropriate messaging into addressing the business factors of it, which we've already heard, as Sally said at the upfront, significant business and cultural impacts from heat. Just like mental health, there were coalitions that were built to help address it, like One Mind at Work, Business Group on Health, and SHRM. We're all kind of addressing this issue in separate ways. An external factor like COVID-19 definitely accelerated the discussion and moved significant steps forward in providing supports and interventions within the workplace. But still, I think the gathering of businesses together with civil society, kind of like this organization now, really helps elevate the issue. And you help a collective pull to drive the media narrative to those stakeholders that need to take action within the business community. I also would be remiss to not mention influencers and celebrities. And, there are influencers like, people that are true celebrities like Simone Biles or Selena Gomez, but in this new world of media, we also have kind of news influencers or influencers in general, like whole subsections of climate influencers who could also be advocates in this mission. It's about kind of sharpening the storytelling for them, making it a clear narrative that they can communicate and, actions coming out of that I think really dictates success and use of the media. It's by no means a snap on, snap off. It will take time, but communications can be an incredible, powerful tool for this issue. And the combination usually of data and human stories, backed by coalitions and nonprofit support, tends to be a winning combination. In order to, position this not just as kind of an annual inconvenience that we all have to deal with, but a true issue that everyone needs to be aware of and we need to be addressing.
Great. Thank you very much, Natasha. And thank you for highlighting that there are past examples we can learn from, because mental health is a really good one. It's come from the periphery of our understanding to actually a much greater awareness that informs how we go about our day-to-day life. So thank you for that. Two more panelists to hear from, three more actually, which is great. So we've heard about the impacts of heat on different sectors. We've begun to hear about the solutions, be that really simple but smart interventions in workforces, but also how we can equip community healthcare workers. And we've heard about that outsized role of communication and media in terms of raising awareness and shifting behaviours. Another sector that really does have a very big role to play is tech and innovation, particularly in this tech-enabled world in which we find ourselves. Franco came along to the session as part of New York Climate Week, but Franco, would love to just get your perspective from somebody who on LinkedIn you call yourself a Google specialist, but you're definitely a man that knows a lot about technology and innovation. Over to you.
Awesome. Thank you, Sally. Actually, a Zoogler. I used to work at Google
A
also. It's
Zoogler. That's
yes.
it.
Yes. Thank you, Sally, for that. And thank you for having me. So I'm very excited to be here and talk about how technology can play a role to ensure business continuity. If you go to the next slide, please. I'm being at Capgemini, we work with a lot of customers focused on ensuring business continuity, but doing also in a context of being sustainable and leveraging technologies from a renewable perspective and energy conservation. One of the things that Scott talked about before, buildings is where we all work, and we also spend a lot of time during the day. And this is really important that we manage these buildings effectively and leveraging technologies like artificial intelligence, IoT, and really manage HVAC systems. HVAC is what controls cooling in these buildings, and it is a huge expense for organizations, and it also is what keeps people comfortable so they can actually work during the day. So one of the things that we do in a lot of work with customers is for ourselves in our buildings as well, is ensuring that our HVAC systems are working optimally. So we deployed IoT devices on these units. So the things that Train technology provides, these very large systems that control the cooling and the heating in buildings. And then using artificial intelligence, we can continuously monitor these HVAC systems for heat patterns. We can look at weather forecasts. We can look at maintaining comfortable conditions. We can look at room occupancy. We can look at different aspects of how the buildings are being utilized and be able to make decisions to actually, one, reduce the impact of the amount of energy we consume. It's all about energy conservation. We want to be able to keep people comfortable, but doing this at the least amount of energy utilized. And then also doing predictive maintenance. How do we actually ensure that these systems are running optimally and that they don't break? Because when these systems break, it's very costly outages, and also impacts humans, because if the system's down, it's going to be hot. People are not going to be able to work there. So we actually continuously monitor to ensure that we are predictive. The things that you fix before they break end up costing you less and reduce also the impact on the individuals. The other thing that we're seeing a lot of organizations doing is using cool service technologies, like a reflective cool coatings on green roofs, installing the plants and gardens and so on. That actually helps reduce temperatures and reflect sunlight to provide insulation. These are simple techniques and things that we can leverage a lot of the technology that we have today to really manage our buildings more effectively. So one, we reduce cost and increase comfort at the same time. If you go to the next slide, please. One thing that we've done at Capgemini, we're actually very proud of this. We've won awards. We've actually implemented these technology in India. We have what the concept of Energy Command Center, which is across 70 plus offices in all of our facilities in India. We use IoT, we use AI, we use Gen AI as well, and we continuously monitor our HVAC systems. This is for offices as well as the data centers that we manage for our customers. We have very large customers that we manage their IT infrastructure, we manage water. So what we've done is we've deployed a lot of renewable energy sources. We use solar systems to actually generate the energy, and then we use these AI and HVAC systems in IoT to continuously monitor the use. We reduce the temperature in the rooms or increase it depending if it's winter, to make sure that we actually reduce the energy consumption. And we've achieved a significant savings, as much as 25% of energy saved, and also cost savings. One of the reasons why I bring this up is a lot of times sustainability as being viewed as something that we do to make ourselves feel good. Yes, we do that, but also there's significant savings in adopting technologies from a renewable perspective to ensure that we actually use it for saving costs and also maintaining comfort and doing this optimally. The other thing that we also do is we store a lot of the energy that we consume, that we generate through the solar system. We have battery storage, and not only we store it for our own use at off-peak hours when there's a lot of impact on the grid, but we actually put it back in the grid. So we actually give back to the Indian grid, so other companies can actually, and other individuals can use the energy we consume and we generate. So we actually started in India. We're now rolling this out in Europe, and it's coming to the US and America and Canada in the very near future. We're very proud of this. We work with customers on implementing this as well. So more than happy if anybody is interested in this technology. The last piece on the next slide. It's around workforce technology. I mean, one of the things that COVID really helped us do is giving us the opportunity to work from home, but not everybody still has those capabilities. So, but these are really important. There was a concept of productivity that was talked about before. I mean, obviously, extreme heat is happening. It's happening more and more. So we need to be prepared. So having remote work infrastructure, using cloud-based systems, mobile platforms to work safely from home during extreme heat events. So I know there's a big push to return to the office, but on days when it's too hot to travel to the office, having the opportunity to work from home is really important as well. This came up before about having emergency alert. Scott talked about it in Belém right now. He's getting alerts about the temperature is going to be really high. Digital communications, warning people, and safety measures to ensure that employees and stakeholders are in place. The other technology, which I spent many years working on at Google, it's geospatial technology and GIS mapping to really anticipate when the extreme heat events are happening and where those are. And so you can actually start putting plans in place, both from a business continuity perspective and also from a health risk perspective. So you have preventive actions as well. So there's a lot of technology that allows us to monitor Earth from space, and combine that with GIS mapping technologies. We can get very granular, very precise on where these heat events are going to happen, and we can actually better prepare with the local authorities, the local communities, to ensure that we actually give the information to the users, information to citizens and residents and our workers, so that way they can actually plan accordingly. Last piece is continuity planning software. So integrating these triggers like from the HVACs and other systems to really manage weather conditions, so that we actually are better prepared and we can actually more automation, because obviously we work for very large companies and we have large buildings that we have to manage. So making sure that we continuously monitor these systems and that we have planning in place. That it's not going away, but we need to be prepared. So that's why we think these technologies can be beneficial. And with that, back to you, Sally.
Great. Thank you so much, Franco. And again, a sort of brilliant spotlight on the solutions that we already see out there. And again, the case study, one of the case studies in the report features the Indian example that Franco just mentioned. So please do take a look. On to panelist number 6 out of 7. We're going to ask Jeff now to talk a little about the perspective from insurance and finance. Again, a really critical lever to play. And insurance in particular is coming up a lot in our work as really potential to help accelerate that transition to a heat resilient society and heat resilient economy. Jeff, over to you.
Hi, thanks for having me. So just a little context. I work at Carolina Research, which is the contract and internal research division of Elevance Health, and Elevance Health is the parent company of Anthem. So we'll be talking about health insurance today. And so just a little background, more background. The case study I'm going to be talking about is a collaboration that my team had with our sustainability office and across finance, really across a lot of our entire organization, trying to understand the impacts to our members from heat, and also how these impacts will show up in like financial materiality and in forecasting. So it's really, as a insurer, we're really caring about our members and also caring about the financial forecasting and in financial materiality of these heat impacts. So this work that I'll be talking about was the start of a larger scale look at how heat and general climate is affecting our membership. So what we did in this study is that we wanted to understand how heat is impacting a very vulnerable community. So CKD was mentioned earlier. CKD is chronic kidney disease, and those with CKD are very vulnerable, very high utilization, high cost members. And there's been literature in the past showing that they are more susceptible to heat. But to be able to understand, for any insurer, for anyone in the healthcare industry, we have to know who's going to be impacted and how. So there's a lot of missing information. A lot of research is only on emergency department utilization and hospitalization, but there's not nearly as much on prescriptions, how extreme heat affects outpatient utilization. There's not even that much on inpatient utilization, which is the costliest sort of utilization. So most of the research is on mortality and ED, which is great from an academic perspective and informs a lot of interventions to be done, but there's still a lot that is left unknown. So in this study, we look at all of our members who have CKD across MA, Medicare Advantage, and across our commercial population, and we are really just looking at how does contemporaneous heat affect cost and utilization for these members across line of business and across place of service. And we also are really interested in not in just how heat impacts what we call heat-related illness, but how heat impacts all utilization. So just to cut to the chase and get to the results, we see that this chronic kidney disease population is exceptionally impacted by heat, and it's not just in heat-related illness. So it's also in just all cause. So it's not just that heat is driving dehydration, and migraines. It's exacerbating all conditions. So there's more here than just heat-related illness. There's more here than just ED. So we see the inpatient utilization increases. So there's still so much more to learn. This is just one population, but for insurance, the starting point is really just understanding financial impacts and then understanding how that is going to impact cost trends over time. So yeah, always happy to talk about research. Reach out if you want to learn more, but I want to make sure that we get to the other panelists. So
great. And sorry, Jeff. So with that data, how is it changing the approach that Elevance is taking to its insurance policies?
So
or is it too early to answer that?
Still in the process. So this research just came out, but it is informing interventions that we're looking at, and we are trying to do outreach to members to reduce for vulnerable populations. Still doing a little bit of planning in the background, but there is work planned to help our members, and it is being used by our collaborators in finance to look at trends. So it is being used, but it's still very early on.
Yeah.
And still, I would say the first step is we got to know what the impacts are before we can do anything about it. And this was that step.
Yeah, no, and we hear this from other insurers needing to understand the data that then can inform the forward policy development.
Yes.
Brilliant. Thank you, Jeff. Grace, thank you so much for waiting so patiently. Panel number 7 of 7. Grace is going to give us the perspective more from the policy dimension. But Grace, over to you.
Thank you so much. I was wondering, I was closing it out, and it was like a honored position to be in. Thank you all for being here. I'm happy to talk about our work at the Federation of American Scientists to coordinate US-based, local, state, and federal policy and bring scientific expertise and evidence to the policymaking conversation. Next slide. So the case study you'll read about in the report, which we're really proud of and excited about, is our work to build a community of practice around heat policy. I think, as we've heard on this presentation today, there's so many sectors that plug into creating heat adaptation efforts and creating heat preparedness. And it's really important that we steward this collective effort and think about how we can build that collective action framework that they could plug into some of the media narratives and the community of practice narratives that we heard earlier in this call. So what we did at the Federation of American Scientists was about spring 2023, we're aware that heat was a growing concern. Media was talking about it. Policymakers were interested in it. What we lacked was an idea and a framework for action. So we started to think about how we could potentially be a service to that area. We worked to find the heat stakeholder community, researchers and academics and practitioners who've worked on the extreme heat issue for decades, to help us to inform what could possibly go into federal policy recommendations. We at Federation of American Scientists are also love to bring people along a policymaking process. So we did a policy sprint, which essentially was a 3-month boot camp to take a subsection of those stakeholders and generate about 160 different policy ideas. Over the course of several months, we then created space to talk about these ideas and convene, including one of the first ever heat policy convenings here in the US, which brought local, state, and federal stakeholders into conversation. And the final thing we did was we helped to bring an organizational coalition together to endorse a federal 2025 heat policy agenda, which was a kind of a first effort to try to think about how we could create heat preparedness in this political moment, as well as kind of bring that support together. And we're always, again, looking for more organizations to partner with and build that broader coalition, showing that there is a demand for these policy ideas. And then next slide will just show just a snapshot of a range of organizations, from the local government perspective to the lands and forestry, to housing, to clean air, to food systems. There's so many different organizations in the civic sector that are interested in the heat issue. And so we think of it as a broader coalition to be organized here. Next slide. And I think at the end of the day, as we think about the issue of extreme heat and the governmental role here, what we need to be thinking about is government capacity and government ability to address these extreme heat challenges. Given these diversified impacts, what we need are leaders who can actually think about the multi-sector issues of heat, not just a health lane, not just an agriculture lane, not just a buildings lane, but a kind of whole kind of perspective of the issue, and have actually the authority to move the policies forward, which we see as a major challenge in terms of the unauthorized nature of heat action. It's happening, it's just not in statute. We also need a regular way to assess and understand what heat is doing. We've heard on this call today, even just getting the healthcare impacts in place, the energy impacts, the labor productivity impacts. That helps us to guide and streamline our responses. I'm a big fan of plans. I also think plans need to be in place for the public sector that also bring in those private sector actors and help everyone steward a response that actually protects the most people now and also plans for longer term adaptation. And then the real thing is action. It's not, a plan is great, it's a stewarding action, but it's not the only thing that is needed. You need to actually first respond and have a system of responding to heat waves that protects the most vulnerable. And we actually need to see that long-term capital gain going to the heat adaptation work, where we know the heat is here to stay. The money needs to go into the investments to help the steward a more resilient future. So with that, so excited to close out this panel, and I'll hand it back to Sally for
Thank you,
Q&A.
Grace. And thank you all. And once again, apologies for those of you that joined a little late. We're really sorry about the gremlins that were in the tech system today. We've got a couple of minutes left, and I just really wanted to do three things, if I could. The first is to say thank you to our panelists, many of whom, if you heard, have contributed to the white paper. And thank you for those of you all on the call, many of whom have contributed also to the white paper in the convening in June and then the session in September in New York. The white paper really does represent the collective wisdom of many, many leaders in this space. So that was the first thing to say. The second thing to say is that any report is as good as how it's used. And so we are really, really keen through the Climate and Health Coalition, through our partners, to keep the drumbeat focused on this report and to bring together the contributors probably in the new year to see what progress that we're making and to look at the applicability of the collective roadmap for other geographies. And that's Scott's job in Belém, is to see if he can get more interest in taking this collective roadmap to other geographies. And then the third thing I wanted to do was to try and sum up everything that we've heard today. And I'm going to have a go. It's not brilliant. I know we're out of time, but I've been listening hard for.
Paper says, Sally.
So was that, Scott?
So I was going to say, so the paper is the best summary.
Yes, it is. But to summarize the summary, 4 ingredients for collective action on heat, and this does spell heat. And so the first ingredient is H for human stories. Barak, you really brought that to life, but we know that human stories are such a powerful lever for change. E is economics. Both the economics, the value at risk from not acting on heat, but the value to gain, the huge productivity gains. And Franco, you talked about that really nicely. A is clearly for awareness. We still have patchy awareness of the impact of heat in different parts of the private sector, other parts of our economy. And T is an odd one. It's threads. It's how do we thread all of this activity together and elevate all of these different brilliant examples to create this collective roadmap. I think the more we can thread these things together, the more we can shift the whole conversation. So they were my 4 little ingredients, and they do spell heat, so I'm quite pleased with that. But there's probably other things I could have said. But it's 1 minute past. So just thank you all again. Personally, I think this report is one of the best things we've done at Forum because it's a really brilliant articulation of the power of the collective and the power of what bringing together different parts of the system looks like and getting really specific and granular about what we would like to see. So more soon. Scott, hope Belém goes well. Please spread the message. And just again, thank you to the panelists for having nerves of steel at the start of the call where it looked as though absolutely nobody was going to turn up. So well done for that. And also thank you in advance for staying with us on this journey. It means a huge amount. And thank you all for putting up with the kerfuffle at the beginning. More from us soon. But please take the report, share it far and wide. Give it as Christmas presents maybe to the people that you love. But make sure everybody reads it because it's such an important piece of work. Thank you all. Have a good day, everybody. Great to see you.
Take care.